The multifidi are deep muscles, but more than deep, they're medial muscles. They're just off the border of the spinous processes. So if you intrude into two arcs on either side of the spinous processes, snuggled up against them, then you're contacting the multifidi. Each multifidus originates at the root of a spinous process and then travels down 2 or 3 or 4 vertebral segments to attach onto a transverse process. Trigger points in the multifidi will cause a pain that's really spinal in nature and often tied together with facet joint dysfunction. You can strum multifidi by going at right angles to their fiber direction, and you often feel taut bands that you can travel along. You can drop the tone by a sustained shift of the muscle or by strumming manipulations or by stripping manipulations. The multifidi can be assessed for fullness by palpating on either side of the spinous processes and proceeding down the spine. So fullness can indicate high tone, or a lack of fullness can indicate that the muscles have lost their tone. And this is often a result of an acute spinal pain disorder. Because the multifidi create segmental stability to the spine, if you lose tone to a section of multifidi, then your spine is vulnerable to instability and to repeated trauma. So the only way to get the tone back in those is to actually do core strengthening with the transversus pelvic floor and learning how to recruit that particular multifidi.